Most people ask the wrong question. It is not how many months you can stay on Ozempic, semaglutide, or Mounjaro, tirzepatide. The real question is whether the drug is still helping more than it is hurting. Some people stay on for years with steady benefit. Others should stop sooner because side effects or poor intake start outweighing the benefit. That difference matters because these drugs are not short courses. They are long-term treatments for chronic disease. If obesity or type 2 diabetes is still active, treatment may still have a role. That can remain true after the first wave of weight loss or blood sugar improvement. Time changes the safety question. Early on, the focus is how well you tolerate each dose: nausea, vomiting, constipation, or diarrhea. Later, the question becomes more practical. Are you still getting clear benefit, or are you trading muscle, hydration, and daily function for a lower number on the scale? I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The basic reason some people stay on these drugs for a long time is simple. Neither drug comes with a label that says you must stop after a fixed number of months or years. These medications are built for ongoing weekly use, with dose adjustment and repeated follow-up along the way. That does not mean unlimited use is automatically safe. It means the stopping point is clinical, not calendar-based. The right time to stop is not 12 months or 24 months. It is the point where side effects, cost, poor intake, or weak benefit begin to outweigh the reason you started. There is also an important split between diabetes treatment and weight loss treatment. If someone has type 2 diabetes and the drug is controlling blood sugar with acceptable side effects, longer use can make sense. Weight loss is a little different. If progress stalls, eating becomes too restricted, or muscle mass begins to slip, the case for staying on long-term becomes weaker. Longer studies show these drugs can keep helping over time when benefit stays clear and side effects stay manageable. That matters because obesity and diabetes are chronic conditions, and chronic disease often needs chronic treatment. Still, study results do not mean someone should keep escalating the dose. They also do not mean someone should stay on the drug without checking the current dose. It still needs to be helping more than it is hurting. That is where many people misread the next step after early success. They think reaching a plateau means the drug stopped working. They also think pushing to the highest dose is always the smart move. Neither belief is reliable. A plateau can still mean the drug is doing its job, and the safest long-term dose is often not the highest one. The real long-term limit is often much quieter than people expect. It is not always pancreatitis, a gallbladder emergency, or a dramatic hospital visit. It can be a slow drift into undereating. Protein, fluid intake, and strength all start to fall. The scale looks better while the body is doing worse. That is why long-term follow-up cannot be just a weight check. A person can look successful on paper and still be losing ground in real life. Safe long-term use means the drug is helping the disease without steadily reducing muscle, energy, bowel function, and normal daily strength. Another quiet problem is that people sometimes normalize feeling unwell. They say the nausea is manageable, the constipation is not that bad, or the appetite loss proves the medicine is strong. But long-term treatment is not supposed to make normal eating feel impossible. If everyday function is shrinking, the plan is not automatically a good one. When that pattern starts, the next step is to identify who needs closer caution before staying on longer. One group is people with persistent stomach symptoms. Ongoing vomiting, severe constipation, repeated dehydration, or pain that keeps disrupting meals should not be treated like a minor inconvenience. Those are signs that the current plan may be asking too much from the body. Another group is people who are eating poorly and getting too little protein. Maybe they are eating less overall, or protein intake is too low. Maybe they feel weak getting out of a chair or more tired during routine activity. Those details matter because staying on safely is not just about tolerating the drug, it is about preserving function while using it. A third group is people whose medical situation changes the risk picture. Surgery is one example because these drugs slow how fast the stomach empties. Pregnancy planning is another. Eye disease and diabetes can matter too, especially if blood sugar is improving rapidly. The drug may still make sense, but the plan often needs tighter timing and closer review. After those special cases, the real issue is whether long-term use still fits the person in front of you. Can you keep taking the drug without losing normal eating, strength, and daily function? Long-term use still fits only if the dose is giving clear benefit. Symptoms also need to stay acceptable, and nutrition and strength should not be steadily declining. If long-term use still fits, the best maintenance dose is often the lowest dose that still works. More appetite suppression is not always better. A lower dose may be safer. That is especially true if it lets someone eat enough protein, drink enough fluid, and function normally. Follow-up should match the goal of preserving the drug's benefit while protecting normal eating, strength, and daily function. Some people need weight and blood sugar reviewed regularly. Some also need kidney function checked, bowel symptoms reviewed, eye checkups, or a medication review. The right follow-up plan is not the same for everyone, and it should change over time. Safe long-term use is an active decision, not an automatic refill pattern. Even with a good follow-up plan, many people still judge success too much by appetite suppression. It is only one signal. Long-term success should also include hydration, enough protein, preserved strength, and a diet broad enough to support normal life. You are not trying to win a contest in eating the least. Ask 4 direct questions. Is the drug still giving clear benefit? Are side effects mild and stable? Are nutrition and daily function holding up? Would stopping quickly bring back weight gain or higher blood sugar? For many people with obesity, what happens after stopping matters a lot because weight regain is common. That does not mean everyone must stay on forever. Obesity usually behaves like a chronic condition, so needing longer treatment does not automatically mean the plan is failing. For people with type 2 diabetes, the case can be stronger for a different reason, because stopping may undo several benefits at once. If blood sugar, weight, and overall risk are all better, staying on the drug may be safer. The drug is not harmless, but untreated disease may be more harmful over time. That balance between benefit and harm is what sets the safer duration. That is why long-term treatment makes sense only while the benefits still clearly outweigh side effects, poor intake, and declining daily function. For some people, that balance lasts for years. For others, the drug is no longer helping enough to justify staying on it. The goal is not to stay on these drugs as long as possible. The goal is to stay on only while they are still helping more than they are hurting. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.